So let's talk about what the state of Arkansas has done with PBM reform. They had a bill that they announced in legislation and it's gone through, and now we're looking at real numbers from this PBM review in the state from the Department of Insurance. So, in one of the cases last year, regulators saw there was a cancer drug transaction that was moving through the system at a little over $19,000, while another acquisition cost benchmark for the same treatment category was reported at $97. So we're talking about the same treatment, same therapy, but there's this massive price gap or difference between them. And before we jump to a conclusion, this doesn't automatically mean that someone is pocketing $19,000, right? But it does raise a very important question. How does a healthcare system allow that kind of spread to exist in the first place? This is Ansolve, probably your 6 or 7 Medicare Minute. Let's get into it. All right, so I kind of touched on this yesterday with 340B program, but I want to go into what Arkansas and the DOI and legislators are doing there. So a PBM is a pharmacy benefit manager, and it's someone who sits in the middle of the prescription drug system. So PBMs, pharmacy benefit managers, they negotiate drug prices with manufacturers. They manage formularies on Medicare for Part D and MAPD. They determine the pharmacy's reimbursement amount, and they process drug claims for insurers. So when you fill a prescription, right, the PBM will often determine what the insurance plan is going to pay for the prescription, then what the pharmacy gets reimbursed, and then what your copay as the member or the patient, I guess, the structure looks like. Now that's enormous, right? Because that's a lot of power in someone's hands. When pricing control sits in one middle layer, and then you also control reimbursement, you literally are influencing the entire drug structure of the nation's insurance companies, right? So this Arkansas report found something pharmacies have been saying for years. And in a lot of cases, pharmacies were reimbursed well below what's called the NADAC, or the National Acquisition of Drug something. It's drug acquisition benchmark. Essentially what that means is this. You go into a pharmacy, you fill a prescription. That pharmacy might actually get paid less than what the medication is cost for them to purchase from the manufacturer. Now, at the same time, some reimbursements were above the benchmarks in this Arkansas DOI legislation, what they found last year. So you're getting this uneven pricing behavior. Some prescriptions were generating profit for pharmacies and others were generating losses. And pharmacies aren't able to control which is doing which, right? That type of unpredictability then is dangerous for small, especially independent mom and pop